we're allocating $100 million of federal CARES Act money to support that effort, recognizing that that will be in place for quite some time as an ongoing type of operation. Our board had previously allocated $5 million for child care vouchers for essential workers, so that is included in there. And then we are taking the remaining dollar amounts and we are allocating $20 million for cities for documented COVID responses. Supervisor Cox and Supervisor Gaspar had another letter on cities at 50, but the state is sending us tens of millions of dollars of additional money that will go to cities. And so we believe at the $20 million amount, cities will be made whole if we give them 20, and then we estimate we're going to get close to $30 million in state funding and new money for cities, so that would get them whole. But we would allocate $20 million tomorrow for cities while we await the state funding that would go to them. We have $17 million in our plan for economic development and economic stimulus type programs. We know that our businesses have been hit very hard and they are struggling. And so we think it is important to prioritize economic response and assistance. And so the $17 million, we would ask the Chief Administrative Officer to develop specific economic stimulus type programs. I know I've been in conversations with the Restaurant Association about a number of things we might do to support restaurants, but we're asking the CAO to come back to us in 45 days with a plan to allocate that $17 million. And the hope is that we could plug some holes in areas that are not covered by state or federal funding, but we could be mindful of the need for economic assistance and development. And then the other $17 million is a combination of $2 million to child welfare. We have seen a 41% decrease in the number of referrals to the child abuse hotline since the stay-at-home orders were issued. But the reality is this tracks with the simple fact that the majority of calls into our child welfare line are by teachers. Teachers are mandatory reporters of issues of neglect. And so we think that that drop is due to the fact that kids are not in classrooms where teachers are able to call our child welfare line. And so this $2 million would help us increase visitation to go check on these kids, to make sure that they are doing okay, to visit families, to offer support, not only to assess the well-being of the kids who are in these settings, but to also see if there's any general help and assistance we need. This is a part of the mindset of adapting a lot of our things to what we're going through with coronavirus. We think this is a vital component. And then $15 million for behavioral health. We've done a lot of work on behavioral health throughout my duration on the Board of Supervisors. And the reality is the coronavirus pandemic has created a situation where it is less easy for face-to-face contacts between the provider and the client. Now, we have not seen, in fact, suicide numbers are a little lower than they were. We think a part of that is kind of a rally together effect that happens, but we do worry about the longer term tail or trends of what may happen. And so what we want to do is take $15 million to be able to invest in true telemedicine around behavioral health. These are drug treatment services, mental health services, to be able to give our providers money. They can invest in technology and in training in order to equip our mental health and substance abuse community to be able to provide those needed services to those individuals in an environment where it is not as easy to gather in person. We think this investment is not only right and appropriate for coronavirus. I have long thought that telemedicine, especially around behavioral health, is something we should embrace more fully. And so we think that this is not only right to do in the crisis environment we're in and will be in for the near future, but we think that this is a systemic change that can reap benefits moving forward. And then the money to cities, again, we have $20 million allocated in here. That would just be an initial payment to cities, and then we would take the state funding that comes in for cities, and we think that cities would be made whole to the $50 million that Supervisors Cox and Gaspar had initially outlined before we were aware of the state funding. And that recognizes the reality that cities are also sharing disproportionate burdens, and they were not included in the initial Federal CARES Act calculation. It only went to counties and large cities, and we want to make sure that we're helping our smaller cities. So again, the Supervisor Jacob and I coming together to try and provide a comprehensive framework for the allocation of this funding, and any additional funding that comes in, we would have to assess and determine the most appropriate use. But we believe that this formula that we've laid out provides the appropriate and best framework we can to make sure that we're dealing with coronavirus impact from the public health angle, We're dealing with the testing, tracing, and treatment, which is a foundational part of our ability to continue to smoothly reopen. We're dealing with economic stimulus type efforts and helping small businesses. We're helping our local cities who did not receive any CARES Act funding. And we are tackling the mental health challenges and crisis that we are facing, along with what is the impact on child welfare because kids are not in school. And so we think this framework gives us the clearest sense of purpose moving forward in terms of how to most appropriately allocate that. So with that, would be more than happy to open it up to any questions on this item.
Okay. Anyone who has a question, please put your name in the chat, and we will be glad to answer them. Again, economic stimulus package. Glad to talk about the Human Relations Commission. Again, we have a briefing at 2:30 today about COVID-19 stats, but we could also discuss that, what we may know at this point.
James, looks like we have two.
Pardon?
Andrew Bowen and Danny Freeman.
Hi, this is Andrew from KPBS. So Supervisor, I'm sure you're aware the city of San Diego is still trying to figure out exactly how it's able to spend its CARES Act allocation because it can only be used for reimbursement of COVID-19 response actions and not lost tax revenue. So can you explain how the county's allocation through the CARES Act can be used for an economic stimulus package for restaurants and small businesses when it doesn't appear that the city is able to do that?
Well, I can't speak to the city's guidance. I know that our guidance essentially is you can cover expenses or programs directly related to coronavirus. You cannot backfill lost revenue. You can't pay for ongoing operations the way that they had been, but you certainly, as long as there is a nexus or tie to coronavirus, then that is appropriate. And so in our buckets, obviously the child care vouchers, which we already did, were for essential workers. That was clearly coronavirus. The 175 million is coronavirus response. The 100 million T3 coronavirus. Our 17 million for economic development is in direct response to what is happening because of coronavirus, where you had to close businesses, limit businesses, restrict businesses. It is our reading that is completely consistent with the outline of the CARES Act, as is the behavioral health, because again, when you're limiting in person because of coronavirus, then you could fund telehealth because of coronavirus. And child welfare, when we're not getting those reports from teachers who are mandatory reporters because schools are closed, then it's appropriate to spend money to do something a little bit differently. And so I don't know, and I can't speak to if the city has a different criteria or threshold or not. I can only tell you that based on what we have seen in the CARES Act, these are all have been vetted and cleared by our legal counsel and our team, that these are all appropriate utilizations of our $334 million of federal CARES Act.
Thank you.
Yep. Danny Freeman, NBC.
Hey, Supervisor, how you doing?
Good.
A few different questions. So I guess my first question kind of writ large is, why do this all at once? Why have a kind of comprehensive package instead of doing it piecemeal, kind of like you started to do the other week with the child care aspect of it initially? And then going off of Andy's question, how would the county monitor the money that is going to the cities, that 20 million that you've suggested?
Yeah, so the first thing on your approach about a piecemeal, Supervisor Jacob and I have been working for a number of weeks about a comprehensive approach. We think it made more sense to take a pause, look at the big picture, look at the greatest needs, and then allocate this in that proportion. We think that it's a more strategic approach, it's a more comprehensive approach, instead of a kind of one-off whack-a-mole of every small thing that pops up. Let's get these funding in some buckets that are directed towards the areas of greatest need. The child care one was an essential one that popped up as a critical need, and we weren't quite ready with our comprehensive framework, and so we wanted to fill that void. There was an immediate pressing need, but we really thought it was important that if we put this out in a comprehensive way, then the needs of economic development can begin to be met, the needs of cities can begin to be met, the needs of our behavioral health, our drug treatment and mental health providers can begin to be met, the needs of our child welfare can begin to be met, instead of waiting 4, 5, 6 months for every small little program. We want to get it out there in a strategic and thoughtful way. And so we thought it made more sense to do one that covered it from a comprehensive framework. Now, there could be adjustments that happen along the way. Some of the projections, maybe we need a little bit more here, a little bit less there, and we can always come back and adjust. But to at least set the parameters and framework so that we have some clear guiding principles in terms of what we're doing. As it relates to the cities, we're going to work with the cities to assess the proper way because, again, the funds that we have to be spent consistent with the CARES Act guidance that we have been given. We will share that guidance with them, and we will work to ensure that all of their expenditure of the money is appropriate and consistent because ultimately, this is money that came to the county. It's money that we are responsible to the federal government for ensuring compliance. We have great partnerships with our cities. I'm not worried that we will have any issues with that, but we will work with them to make sure they understand the categories and priorities, not set by the county, but set by the federal government when they gave it to us, and we will ensure full compliance with that.
Thank you.
Another Andrew from Fox 5.
Hey, Supervisor. Just a quick question here. Talking about the implementation of economic stimulus and programs for restaurants and businesses. I know that you guys are still, I guess, ironing out the details, but as of right now, how would that look exactly? Some businesses, say that, hey, we haven't gotten any money. How are we, allocating that? What parameters or what factors goes into that? And just from your standpoint, how would that look for you or for the county?
Well, that's a good one, and we didn't have the crystal clear. This is how every dollar of the 17 million gets spent, because a part of it is really assessing that the majority of the economic assistance is coming via the state and the federal government. The state is obviously providing unemployment insurance. The federal government is providing the PUA, the pandemic unemployment assistance, on top of your normal insurance, and the federal government is also providing the Paycheck Protection Program, which is money directly to small businesses. What we want is the 17 million to be able to perhaps fill in some of the gaps for things that are missing. And so that's why we're not specifically outlining every dollar of how this will be spent. We're directing our CEO to work with our small business community in particular, to work with our hospitality industry in particular. I worry about all of our industries and jobs out there. I am particularly worried about our hospitality sectors. I think that the sectors of our economy that are likely to lag the most are things around conventions and tourism, and those are industries that are most likely to be most pronounced impacted. We've also had some creative ideas around how do we stimulate responsible economic activity locally. So you could imagine a gift card type program that is only redeemable at a local restaurant once we get to the point of those being safely reopened. And so instead of specifically outlining the $17 million, we asked our CAO to go work with the small business community, assess what the state government has, what the federal government has, where the gaps are, and then bring us back a package of programs for our board to consider that would be most appropriate to utilize those.
Thank you, sir.
Yep.
Are there any other questions? If not, we can end the call. All right, seeing none.
Danny's got one more.
Oh, go ahead, Dan.
I can't let you off the hook that easy. Sorry about that.
No worries.
One last question on the funding to cities. You were talking about that you expect them to get to that kind of $50 million benchmark based on state money as well. Do you have any idea, though, what a timeline might look like, for the county money to cities, and or when the state might actually be able to deliver that to cities?
Well, if we approve this tomorrow, we could begin moving the $20 million now. And we'll get additional guidance from the state. The governor's kind of outlined, additional money to counties, particularly for cities. And some of that is going to go, so there was a cutoff in cities, I believe of 500,000 or more got direct from the federal government. And I believe the state has said that they are going to directly give money to cities between 300,000 people and 500,000 people. That would not include anyone in San Diego County who didn't already get it. And then they said for cities under 300,000, they would give it to counties proportionally for them to distribute. And so we can monitor that. And even if we know what's coming from the state, it's simply a cash flow issue. If we know it's coming from the state, but it's going to be a little bit later, then we could potentially take, a little bit of what we have in the 175 for COVID and the 100 for testing and maybe front a little bit of that. We could work all of that out. But I think that the important message there is that I don't think we will have any problem fulfilling the spirit and intent of Supervisor Cox and Gaspar's letter of providing $50 million to cities. I think that the state announcement they're going to do more money made it easier for us to address a variety of issues now, knowing that there is more of that coming.
Andrew Bowen?
Forgive me just quickly, Supervisor, just to clarify. That state money that you're anticipating, is that contingent on HEROES Act, or is that budgeted?
Oh,
that
so
is.
the state got CARES Act money directly from the federal government, just like the county of San Diego did and the city of San Diego did. So what the state of California is doing is taking a chunk of their CARES Act money and giving it to cities. So just like the county is taking a chunk of our money and giving it to cities, even though it's not a requirement, the state is also taking a chunk of their money and giving it to cities. And so it's both of us together, looking out for our cities. Does that make sense?
Yes, got it. Forgive me. Thank you.
Yeah, Andrew.
Thanks, Supervisor. So along the lines of economic stimulus and specifically restaurants, I'm wondering if you're aware of a proposal by North Park Main Street to shut off 2 blocks of 30th Street to cars to allow for more outdoor dining. It's kind of been discussed in the abstract in lots of different cities around the country, opening more outdoor dining space to allow for social distancing when restaurants are allowed to reopen. Is that something you're aware of? Do you support it? And would that be maybe a potential use of that funding for the stimulus pool?
So on the first question, I 100% support these efforts around outdoor activities. I think that is a wonderful idea that they have proposed. And Andrew, I think as we look around duration and intensity of exposure around spread, I think that what we're going to see is moving forward, it is just simply much safer to do a lot of these activities outdoors. And so I think there's going to be a renewed focus around outdoor dining, outdoor gatherings, outdoor activities. I know I'm in a number of discussions and have been actually pre-coronavirus with the port and other entities around some really creative opportunities around the waterfront near the County Administration Center. And I think that we all need to think about how we look for every opportunity to create more outdoor access for recreation, for dining, for gatherings. And I think that is not only something that folks enjoy, it's something that San Diego is well equipped because of our weather to do. But I think from a public health standpoint, it's going to be much preferable to a lot of these things happening indoors. And so I think that is a very creative proposal that they put forward. I think it makes a lot of sense, and I think it's very consistent with a lot of public health guidance. Is that something that would come out of the county funding for economic development? That remains to be seen. The city of San Diego also got significant CARES Act funding, and they don't have the same obligation to pay for public health services the county does. And so I think that they'll have a greater degree of latitude in providing as much help. But it's certainly a project I'm personally supportive of and would love to do whatever I can to try and help it.
Thanks.
Yep. Before we go, just one other point. I would encourage everyone to watch the governor's announcement here in about 30 minutes. At the outset of moving into stage 2, the whole state of California has been progressing through stage 2. The governor outlined some local variance rules that allowed smaller rural counties to go through stage 2 much faster. Did not allow anyone to go into stage 3, but allowed them to go much faster through stage 2. And you saw a lot of concern from San Diegans who said we would like to see criteria or thresholds that are attainable by larger urban counties that are still consistent with generally good metrics overall around coronavirus. And so I think at noon today, the governor is going to be making some announcements. It's his announcement to make, but I would encourage you to watch that around a possible scenario of some of the larger counties having a series of metrics that they could meet that would allow us to move at our own pace through stage 2, not into stage 3, but it's certainly something we've been working and communicating, monitoring our metrics, our numbers, and trying to work with the state to have a framework. So I would encourage you here in about 30 minutes to tune into what the governor is going to announce and share today.